Self-Management Week. Tackling mental health stigma and discrimination in healthcare. Heidi Tweedie, Champion and Director, Moray Wellbeing Hub. Follow us on X at Self-Management Scot and Alliance Scot. Health and Social Care Alliance Scotland.
Hello everyone, really nice to see you all. I'm just going to take us through some of the practical parts of the actual tool. So I think it's been really helpful for Patty to give us a great bit of context and setting of why we need to do this. But as people with our own lived experience, as people who are supporters of people who want to make change, we need the tools to do that. And that was the ambition really for setting this up. Just to be really clear, I wanted to let you know a little bit about Moray Wellbeing Hub to make sure that you know who we are. I'm Heidi Tweedie and I'm the social movement and enterprise lead. And overall, I'm there to kind of support our wonderful group of champions, people in Moray who have had their own experiences of challenges in their mental health and well-being at some point, and we want to make positive change. So within that, there were a number of people who were involved in helping to develop that. And thanks to them, I also noticed that within our audience today, we've got a few people from Moray as well, which is amazing. Really good to have you all here. So that's who Moray Wellbeing Hub are in a sort of nutshell. And the key thing for us is always about how we create well-being. So although Patty, does her best to kind of enthuse us and get us excited, at the same time, Patty's really landing us in the fact that these are heavy topics. This is really important stuff, and rightly so. And we have now this evidence base of which we can understand what needs to happen. What also needs to happen is that we need to be able to go through this in a way that actually creates well-being for ourselves as human beings. And so for us at Moray Wellbeing Hub, what's really important is that we always look at creating CHIME: connection, hope, identity, meaning, and empower. And through that, that's a way of promoting positive mental well-being for everyone. And we work right across the whole of Moray. There's a wee map of Moray. It's in the north. I know a number of you know where it is. But really, the thing is that what we do is we're out there, we're doing different work, groups, we're doing campaigns, we're doing strategic work, we're doing all kinds of stuff. And it's that stuff that kind of led into the need for some sort of resource for ourselves as an organisation and for our champions, but also with working with Patty and others, really trying to spread that word, because something that we're really passionate about is almost an open source approach to this. Yes, we've curated it, but I'd like you to see that when you go through this resource, there's nothing new. It's really about making sure that we've got it all in sort of one place. So the aims of this resource is really to focus on this fact that we have that legal right to have our voice heard in how our healthcare is delivered. That's kind of the core part that kind of holds the whole thing up. As we were hearing, there are many people with lived and living experiences who are experiencing the stigma and discrimination of trying to access these services. That is not okay, and we need that to change. We want that to change for ourselves as people who use those services, who've maybe had those experiences, who continue to have those experiences, and we want to change them for others, people who are experiencing now and people for the future. And it should be seen through this line or this sort of viewpoint, this view on the world that it is a breach of rights. So it's not just a nice to have. It's not just that would be really great. It's a must have. This is a right. It's unjust and it leads to inequalities that then further impact people's health. And that's the kind of thing that we can get excited about and energized around. We think that people who are obviously using those services, it makes obvious sense in the public domain. If you're doing a service, if you're creating a product, the people who use it, they're obviously going to be the people that know how to best access it, what they want from it. But for some reason, we haven't always got that idea when it comes to services. There is that power dynamic, and that's really important that we can redress that and we can be in a much more equal position. So another part of this is that we need to understand how those actual systems are constructed. Because if we don't understand how they fit together, we could be wasting effort, we could be confused by different things, we could be pushing it apart. That doesn't make a lot of sense. So that's kind of what the resource aims to do. And the resource is split into 3 sections. So we have an understanding the basics section. That's there to give us an overview of how healthcare works in Scotland and introduces mental health stigma and discrimination, its impact on people accessing and receiving care and treatment, as well as how to influence services to become free from stigma and non-discriminatory. The next section is taking action in 6 steps, and that gives us the 6 steps to taking actions in challenging mental health stigma and discrimination in healthcare. Each of those steps gives you key information, advice, and guidance, as well as some top tips and links to help you get what you need fast. The third section is there for additional bits and pieces. It's tools and resources that we've pulled together to kind of take you a little bit further. So you can kind of dip in and out of that especially. It also contains lots of signposting information to other organisations because, my goodness, there are loads of great resources out there, especially on places like the Alliance website, other parts of the CME website, and other colleagues who are doing great things there. So we need to kind of link them together a little bit. How we use this resource? Well, what's fantastic is working with CME has let us experiment to pop this as an interactive website page approach. I don't have a really good name for that. That's I should have come up with that first. I've made a little QR code because then for some of us like to take screenshots as we're going, or when you get these slides, you might want to use this for some reason. But in the chat, we can put the little bit.ly link and maybe just go and get it for us all and pop it in just in case you want to look at that while we're having a chat about things. So the idea is that it's hosted on the CME website as part of our partnership. And you can go in and you can kind of read it like a resource, like I'm going to read this section, I'm going to read this section, I'm going to go to this section. But really it's there also to be kind of dipped in and out of. And it means that if you're also sitting beside someone and you're kind of looking for something to help you or help them to navigate an issue, you can kind of just go and get that section up. And it's not like you have to print anything, but obviously you can do that if you choose. Basically, you could navigate it, I think. If someone already understands healthcare really well, they might start with the 6 steps. And if they want to get a better sense of the landscape, for example, if they're not really sure, well, actually, how do I get into this? Like, where is it I need to put pressure? Where is it I need to speak to someone? Then you start with that understanding the basics. And then obviously you've got that third section that might just give a little extra as you're going along. So as we talked about previously, this idea that empowering peers is really the best way that we can go about creating this change. We need change to happen. The best people to take that change forward are people with lived and living experience. We can refer to them as peers in this context. So how do we do that? We need to empower them, give them all the resources that they need to be able to take that forward. And there are 4 sort of areas there that can really support us. So those are things like building skills, capacity, and opportunities. They could be things around making sure that we have the training as leaders, as champions, as influencers, which is kind of the people that I can see around us today at this event. It's making sure that lived and lived experience is at the heart, and we're going to talk a little bit about that later. And also that social movements like ourselves, like the social movement that CME hosts, and other social movements such as United to Prevent Suicide, for example, they are mechanisms that we can use to bring resources to peers. So it's important to remember that these are kind of the core things that we kind of need to keep around us when we're kind of using the resource. And it can really help people to know that they're not on their own. The ambition is not so much that people use this and they just go along it in a straight line. The idea would be amazing to connect people with lots of other people because the journey is not always straightforward when we're trying to create change. That's not always how it works out. So let me just take you through, first and foremost, the first section. I'm going to give you a little kind of overview of this. I'm going to show you some parts that come from the website that you might expect there, but there's loads more in there. So just so you get a sense of what you might encounter if you go and have a look at that section. And really, it's really important to remember that we've got this section because you can't really look at reducing mental health stigma discrimination until you have an understanding of what the setting is. And when we were developing this particular resource, one of the things that we did is we did a lot of that with fellow champions. And a lot of them had a lot of things in this section that they were very surprised about. And they went, That explains a lot. Now, I really appreciate that this triangle is quite small, so I will read these parts, but it is on the website and you can zoom into it. And if you have any access challenges to that, please let us know and we will do our best to get a better and more high quality copy to you. One of the things that people don't quite understand often is actually how healthcare services are actually organised. Where does all the resource go? So if I take us from the bottom up to the top, you can see in the yellow section, which is at the bottom of this triangle, self-care, prevention and education. Then above that is community support. Above that again is what we would call primary care. That's your GPs, your pharmacists, your dentists. Above that is your secondary care, things that you usually have to get a referral. Sometimes you can do a self-referral too. So that might be the mental health team, occupational therapy, A&E. And then you have at the top tertiary, that's specialist services. So the idea is that on the top, we have fewer people using those resources, and there are more people using the resources at the bottom. So that's really how things are organised. And that's when people hear words like primary, secondary, tertiary. And there's lots of language that goes around in healthcare that we as consumers of it, as people who are citizens, who are patients, we don't quite often know what that is. We're not taught this necessarily in school. And unless we've had any experience, it might be something that's quite difficult to kind of get our head around. And a wee tip that I always thought was really helpful for myself when navigating all of this was always to think about how, if I'm trying to influence, for example, a particular service or work with someone, if I ask that question, how is that funded? That usually makes it clear who it is that I need to then go to. For example, if someone is getting public funding, so funding through the health and social care to deliver on their behalf, then you know that you can go through some of the feedback systems for services that come under that umbrella. However, if an organisation is working independently, like a group, like a charity, a community offering, that would be a different thing that you would go direct to that organisation. So although many of us might have concepts about how we might complain or give feedback in a traditional way, it's about finding where those particular things are. And one of the things that I think is really important is to mention care opinion. That's a big thing that's so important. If you don't know care opinion, make yourself really go and look it up and enjoy care opinion, which is a fantastic website, which really offers an opportunity to feedback on all these services in a really inclusive way and effective too. So, aside from information about things like structure, the other thing that we focus on in that section is to get people familiar with some key concepts and terms. Some of these, I think you guys might be familiar with. Others might be, I didn't know that that was called that. So first up, we've got time-space compassion. We're increasingly going to hear this particular phrasing. It came from suicide prevention and responding to crisis. And the idea is obviously to give people support at the right time, in the right space, and to make sure that they're shown compassion by those that are offering support. A lot of that, if that was happening, much of what Patty was talking about from the survey wouldn't have happened in the first place. We would not have received that kind of stigma. Two other terms, slightly different. We've got the medical model, the concept that that's a way of explaining treating mental health challenges through diagnosing illness and then using treatments. And we also have social model of disability. So the fact that disability, people aren't necessarily disabled in themselves, but they are disabled by the barriers that society creates when they have not designed things to be inclusive. Another three, mental health recovery and CHIME. You heard me talk about CHIME before, but the concept of recovery is something that should be really well embedded in services now, but isn't always, and that everyone has a right to their definition of recovery and moving forward with that. Peer support, also another concept that's growing and growing. And intersectionality. I still struggle sometimes using that word myself, but I think we're all getting a little bit more comfortable with the concept that actually we are no one thing, as Patty was saying earlier. We are many things that transact. And it's the fact that stigma builds up from all these different places, all these different identities. So you might start to hear that word quite a lot. It might be a word that you find really useful. So that is more than enough for me on this particular part of the resource. I want us to kind of have a chance to go into some breakout rooms and have a little chat about some of this. So you'll be popped into groups in a second with a lovely facilitator. But when we go into that group, I just want to encourage you to consider a few things. This is our little group agreement that we use in Moray Wellbeing Hub all the time that is based around chime. And just reminding us to be connecting. We all have lived experience around mental health from whatever degree, and that's valid. That we take a strength-based focus. It doesn't mean that we don't need to bring up challenges. That we make sure that everybody will have a voice. The facilitator's there to help balance that a little bit. And the facilitator will also keep us on meaning. And if for some reason you can't join in because you don't want to speak or something, you've got the chat. We also would love ourselves, CME, the Alliance, we would love it if, say you have some feedback, either in the feedback form at the end, or you want to give us that in a different way, we're really open to that.